or any kind of CBC or hemoglobin test. So we'll be drawing with those. I'm going to swab your arm or your area off and get an idea if I like the vein in this arm, which I don't. So we are going to switch sides and reposition the camera. Hope, can you come over here and volunteer to position this camera on this man's arm? And I'm going to ask you to kind of turn around this way a little bit. Okay, and I have a much nicer vein. I can actually see a green color right here. And hope you need to make sure you're actually videotaping it.
You're not.
Okay, so I'm just going to roll your sleeve up. I'm going to apply the tourniquet. And I just want you to know that I'm here to get your blood.
Okay.
And do you have any problem with getting blood drawn? Do you ever feel faint or get nervous or nauseous?
Not until today.
Not until today. This is the first time that I'm actually going to be drawing my own husband's blood. Okay, we have a sterile hypodermic needle right here that we're going to use. I'm going to take the cap off. And this pink area right here is a safety harness that when I'm done, I will flip this, and this prevents re-needle sticks. Okay, so I see my vein, and I'm just going to flick it to get it to puff up a little bit and ask my patient to close his fist and open and close a few times to pump that vein up. Okay. Open and close a few more times. Okay, ready? Big stick. Now I've taken my tube and I'm inserting it in, and as you can see, I have a good flow of blood coming in. These tubes are made that they're vacuumed tubes so that they will actually stop taking blood as soon as they're filled to the capacity which is needed for the actual blood test. Are you feeling okay? Okay. Now you also want to invert the tube. This prevents any coagulation and any chemicals that may be in the tube to prevent coagulation to mix with the blood. Okay, here's second tube. And you see where my hand is held. It's in a position to where the hub is resting on it so that I can change tubes comfortably without making the needle go in and out of the arm out of control. Okay, now I'm going to release my tourniquet, take my tube of blood out, and I'm going to take my 2x2 gauze, which you're going to kind of fold into a square. The square actually helps compress the area, withdraw my needle, flip my safety switch open, so now I cannot get stuck. I'm going to ask the patient to leave the gauze on for 10 minutes while that area has a chance to clot. All right. Now, Mr. Miles, how was that?
Didn't feel a thing.
All right, now I'm going to let my next patient come, and this is Hope Miles. And Hope, I'm going to ask you to sit, and I'm going to demonstrate. Always remember to label your tubes and put them in your biohazard bag at the same time you're drawing from a patient. Okay, I'm going to demonstrate the use of a butterfly on Hope. And a butterfly is, you either have to use a transfer device or I could actually use a syringe. I prefer a transfer device if possible. Okay, usually a butterfly, you can obtain that sample. Hope, I need you to turn a little bit this way for me so your hand is not, I'm going to put your hand right here. Okay. If a patient doesn't have good veins in their AC area, which Hope I know from the past does not have very nice veins up here, and her veins lie really deep instead of to the surface. So we're going to take Hope's blood from her hand because this is a good access point. All right, Hope, and I'm just going to ask you to relax your fist just like that, and I can see a nice vein. I'm going to give it a little tap here, and that helps it to puff up bigger so that we can see it. All right, and I am going to use alcohol to cleanse her area and sterilize it. Okay. All right. This one. And these are called butterflies because, of course, you can see the actual wings. This helps aid in getting this needle into the vein accurately. And actually, you can see a backflow when you've actually hit the vein. Okay? Hope, are you ready?
No.
It's okay. It's going to be just fine. Okay, big stick. In there, you can see the backflash of that. I know I'm in the vein. And I'm going to be drawing on Hope. Blue tubes are used a lot of time to check clotting factors to see how long it takes your blood to clot. If the blood is not coming out as fast as you'd like, sometimes you need to withdraw just a little bit. And you can see that she is doing quite well. We're going to release the tourniquet because we only need to get this one tube off of Hope. Okay, the tourniquet is released. I'm going to take my tube out. I'm going to invert it 3 times. And then I'm going to use my gauze. And I'm going to place it right here. Withdraw the needle. Hope, can you put pressure on that for me just a minute? And this has a safety mechanism that it will close up over the needle like that. And these are both going to go into Sharps containers. And we will apply tape to hold that bandage in place. And Hope, you can take this off in 10 minutes. Okay?
Okay.
All right. Upon completion of the draw, you have to make sure you use the 2x2 gauze so that the patient does not experience any bleeding. Both of my patients are complete. The venipuncture went successful, and I feel that I have drawn them in a compassionate and gentle manner. Thank you.